I want to welcome the newest member to our subcommittee, Senator Murphy.
Thank you very much, Mr. Chairman. It is an honor to join this prestigious subcommittee, and grateful for the opportunity. Thank you all for being here today. I'm really grateful for the chairman, the ranking member's focus on the suicide epidemic and for all of the work that you've put into it. I wanted to talk to you, Rear Admiral, about a very specific case that I've become intimately and tragically familiar with, and that's the death of 7 sailors on the USS George Washington just last year. One of them was a Connecticut resident, seaman recruit Xavier Sander, took his own life with a service-issued firearm. By now, you know that the conditions on this ship and the conditions for these sailors was, frankly, just unacceptable. This was obviously a ship that was going through a major refueling and complex overhaul. The conditions on board required a lot of these young men to be sleeping in their cars, to be making long trips home, to get away from the chaotic scene, and the access to mental health was just completely inadequate. Sailors who were seeking routine care on a ship that had significant conditions affecting mental health were facing waits of up to 2 months for care. Members of Seaman Recruit Sanders' division reported that they were often hesitant to seek mental health treatment through Navy channels because they were under the impression that it would affect their future career opportunities. Obviously, this is exceptional that we had so many individuals take their life in a short period of time, and I know that there is still a final investigation that is outstanding, but what can you tell me today about how we're changing conditions for our seamen who are living under these kind of conditions and how we're making sure that they have access to mental health services?
Thank you, Senator Murphy. From the Secretary of Navy on down, we have taken this issue very seriously, as we have taken the general issue of mental health and suicide prevention seriously. I can tell you that our immediate response was to send a special psychiatric response team. That was to counsel those who were directly affected by these incidents, these tragic incidents. We've learned also that it's important not only to respond acutely, but to have a prolonged response, and so all of the members of the George Washington are enrolled in what's called Orion, which is a periodic check-in to assess how they're doing and ask if they need help. Historically, when we've done this on 5 previous occasions, we have about a 20% take rate, and we directly do a warm handoff for those individuals. But the larger issue, sir, is ensuring that we're creating a resilient force. GW certainly is an example of a challenging situation to be in a shipyard like that, but our sailors and Marines face challenging situations worldwide, and so developing force resilience is key. Toward that end, all of our recruits now go through warrior toughness training. They learn stress reduction techniques as well as meditation. These are reinforced through their training. In addition, for the GW and for the greater Navy, we have an expanded operational stress control program. This is a train-the-train model. In addition as well, our Office of Navy Culture and Force Resiliency just rolled out a mental health playbook, which provides tools for unit-level leaders and beyond, ways to prevent suicide, ways to recognize an individual in distress.
All right, thank you very much. I'll look forward to follow up with you on that. I just want to sneak in one more question, and that's to you, Mr. Assistant Secretary. We talked a lot about this independent review committee report. One of their urgent recommendations was to address Section 1057 of the 2011 NDAA, which prohibits the Secretary of Defense from collecting any information regarding firearm ownership by active duty members. Now, I think this was due to some concerns about overreach, but I don't think that the drafters of that language contemplated the fact that it is just good medical practice if someone is in crisis to inquire as to whether they have a firearm at home, whether that firearm is properly stored and locked. And so I'm not going to ask you for your view on the law. That's a question for us. But as a rule, is it good medical practice for there to be gag orders on physicians as to what questions they can ask their patients, what information they can try to solicit from their patients?
As a physician, the relationship between my patient and I is kind of sacred. I mean, because we talk, and I expect him to be truthful to me so I can help him. So anything that interferes with that interferes with good medical care. So my position is that. I mean, anything that interferes with a good open discussion between the patient and the physician, or a provider, not necessarily a physician, is not good for either of the two parties. If I don't know, I cannot help you. And if you cannot tell me, even worse. So we need your help to facilitate that process.